So as the country is focused on counting ballots right now, health experts are counting the rising number of COVID-19 cases in Colorado and across the country. Our 9 health expert, Dr. Kohli, is here to talk more about the status of the pandemic in our state. And Dr. Kohli, just remind us, first of all, what the latest data is telling us at this point.
So, Kim, one of the parameters that we've been looking at lately is something called case growth. And this is a nice way to capture how many new cases are we having every day. And what we've seen is that we've now entered a phase called exponential growth. And I think this picture is worth 1,000 words. And you can see in purple the number of new cases that we're having every day has dramatically increased in the past few days to the point where we're having over 2,000 cases every day. And that's, like I said, that's what exponential growth is, which means that as those cases increase, they multiply very quickly. Now, modeling tells us that every person that's infected with the virus is probably going to infect an average of 1.5 other people. So if you take those 2,000 cases, they're very quickly going to become 3,000 cases per day. And those 3,000 will then become 4,500 per day, and so on and so forth. And in parallel to this, we're also seeing an increase positivity, Kim, that's occurring. So our most recent positivity data shows a daily positivity rate of 10.86%, which is way above that safety threshold that WHO had set at 5%. And that tells us 3 things. The first, disease activity is higher. The second, we're not doing enough testing. We really need to increase that testing if that positivity is going up. And then third, that those hospitals are at risk for getting overwhelmed.
And long gone, it seems, those days of 3%, which felt like yesterday. So it's moved quickly. You talk about the young people. We know we're seeing more and more young people become testing positive for this. That also means fewer hospitalizations typically. Does the data support that?
Well, so this is that misconception that's out there, is that, oh, we shifted it into the young and people are going to survive and they're going to do just fine. So I do want to remind everybody that 19% of the people that are going to get this infection overall, regardless of age, are likely to end up in the hospital. So as the numbers go up, we are going to see many of those young people ending up in the hospital. And in fact, we have seen people from every age group. And you can see here on this graph, Kim, that our hospitalization growth is also rising exponentially. And within 6 days, according to models from the University of Colorado, we're going to cross that peak in April that we had. And by January, they're predicting that we're going to cross our ICU capacity if we continue along this trajectory. So this is all very alarming to me. And the fact is that we're repeating the same mistake we made before, but this time we're actually underprepared because we don't have those field hospitals we had before. We don't have those PPE backups that we were planning for before. So if anything, I'm even more concerned than I was back in April.
Plus, everything was shut down in April. I mean, that's the thing. We were living a very different life in April. So what's your advice? I mean, what should we all be taking to heart given these numbers right now?
Yeah, I know nobody wants to hear me say this, but I'm really going to have to echo what our public health leaders are saying. So Dr. Birx, who was here in Colorado just a few days ago, said that we're entering the most potentially deadly phase of the pandemic. So I want to put that on everybody's radar. And soon after that meeting, Governor Polis actually said that it's time for Coloradans to really stop socializing, stop having those family get-togethers, not forever, but at least for the next few weeks, so that we can, again, get all hands on deck and try to flatten that curve once more.
Time for a weekend Zoom cocktail hour. All right, Dr.
Unfortunately, yes. Yeah.
We got good at it in April. We can do it again, November. All right. Thank you, Dr. Kohli, as always.